We as a cohort have learned how to identify preventable causes of child injury, empower patients to share their own experiences, and utilize relevant statistics and science to spread a powerful message to the media and to the public. I've also learned firsthand the complex relationship between hospitals, multi-level government agencies, consumer industries, and families everywhere. In addition to building my foundation in advocacy and patient education, I've learned leadership, marketing, and communication skills. Ultimately, as a future pediatrician, I feel incredibly lucky to have joined this awesome community of trainees and mentors.
Through T4CIP, I have gained confidence in collaborating with multidisciplinary teams across my institution. I have witnessed medical students be empowered to go the extra mile to develop bilingual handouts, ensuring more families have access to this potentially life-saving information. I have honed my skills in delivering effective messaging, both to other medical professionals as well as families in the lay public. I have made valuable and enduring connections with many fierce and tenacious child advocates across the nation.
The T4CIP group really aligned with what I was looking for. It offered not only opportunities for hopping on to advocacy campaigns, but really teaching the trainees how to create those campaigns from scratch, how to develop the materials, how to distribute the materials, and sort of finding your target population and audience and things like that. The group has really been quite educational for myself. It spans not only for fellows like myself, but residents, medical students, and really anyone who's interested in injury prevention sort of advocacy campaigns. And so what I've really enjoyed most is really the networking opportunities that are out there amongst the other trainees, but also for the mentors that are out there as well.
One of my favorite parts about this organization are the small work groups. So at each meeting, we get to work with an incredible mentor and fellow group members ranging from other medical students all the way up to fellows. And I really enjoy working with a group who feels the same passion to protect kids. And I feel like we have such a great support group to guide our local advocacy endeavors at each of our institutions.
It has been an honor and joy to serve as a mentor within the Training for Child Injury Prevention program. And I have just been really impressed with the reach and access to leaders within the injury prevention advocacy universe assembled by this team. And the experience for the students, I think, has really been incredible. I've become close with my small group of students and have heard direct feedback from them that although many of them came to the program with some degree of advocacy experience, this has really been the most formal advocacy training they've ever received. And this has really given them a chance to expand their horizons and work with faculty mentors from outside their institution who may have much greater advocacy experience, and including for faculty mentors, a chance to meet with national leaders on topics that are so core to injury prevention. Our small groups allow for folks to really have careful conversations and direct feedback on their experiences, particularly for these trainees that are being taught to lead themselves. Our first day of action around the prevention of ingestion of high-powered magnets resulted in an incredible social media stir of activity. And then to see just months later the Consumer Product Safety Commission reduce access to those high-powered magnets, potentially as a consequence of some of the advocacy that we provided. That has been so inspiring to watch as a mentor, and then to hear that positive feedback from my mentees. We know that pediatricians need to be advocates for kids who don't vote. And particularly folks involved in injury prevention, advocacy is a major pillar. If there's not advocacy on a local, statewide, national level, then none of our injury prevention efforts will ever really have impact. So this has just been an absolutely incredible experience, and really hope to see other mentors emerge from this program, as I hope I can pass on the torch to folks ahead of me and make the impact longstanding.